Hi, and welcome back to Dirtbag Baseball Talk, everybody. Kirk McNabb here again. And like we said last week, happy to have Jason Colleran of the Kinetic Arm and Elite Edge Fitness with us and doing this series of videos and becoming definitely a trusted part of the network. So, Jason, great to have you back again.
Yeah, thanks so much for having me.
Yep, for sure, buddy. And hopefully you've had a good week down there. I know you've been busy between the fitness component and the Kinetic Arm. You're always evolving with it and a lot of things happening. And so hopefully it's been a great week for you, buddy.
Yeah, it's been awesome. A lot of big developments and looking forward to just keeping on growing.
Okay, well, it's great having you back with us, and you're going to love this episode because I know it's right down your alley. I know it's what you and ourselves are really passionate about, and a lot of questions in from the viewership this week. And thank you, dirtbags out there, to send these in, that passion and that drive to know more and stuff like that. So again, we're going to get it right from the horse's mouth, and Jason. So it's the how to use it, Jason, but also the why. Why the Kinetic Arm?
So it's the biggest problem in baseball. We've got arms breaking down, and it kind of blows my mind that there's been no innovation for the throwing arm in all these years. I mean, we probably thought the first guy to put spikes or cleats on shoes was crazy, and now we use them all the time. But if you think about it, it prevents us from sliding and getting injured. It lets us perform better. So going from that to batting gloves where we can grip the bat better. We've got a lot of other protective gear, like a cup, helmet, elbow guards, things like that, but there's nothing for the throwing arm. So the reason why we need it is because of all these overuse injuries. So if we can offload stress externally and prevent your body from breaking down internally, then guess what? When it's worn out, you can just throw it away and put on a new one, and you save all that damage from happening inside your body.
Yeah, for sure. And we talk about this stress on the arm like it's just an everyday conversation. And unfortunately, it is an everyday conversation, stuff like that. But I think there's a misperception out there, even with the fact that we just think it's always the same type of stress on the arm. We never take into consideration whether we're playing on a wet field versus an ideal condition field. We're playing in the championship game versus just a regular season game or an exhibition game, and that those are different levels of stress being built up on the body overall, obviously, but especially when you're a pitcher, definitely a pitcher, or even a catcher, really, if you wanted to say it that way as well. I think, how does a kinetic arm alleviate that?
So we actually have a muscle on our lower body called the sartorius. So it crosses two joints. And if you were to stand up and lift your knee up and rotate your femur internally, what that muscle can do, the sartorius, because it crosses two joints, it'll rotate it externally. So we have a muscle in our body that does that. We just don't have it for the upper body. So by giving us an external muscular system, it helps us in our weakest range. So in that far layback phase, there's not a pitcher on earth that can stand there and go all the way back into external rotation as much as they do when they have, the inertia and the load of the arm and the ball taking them back. So muscle strength is like a bell curve. So mid-range, we're the strongest, and end range, it drops off. That's why when you're lifting weights, you usually don't go to the end. You kind of stop where you're strong. So it's the same thought process with the sleeve, because when we go all the way back into that layback phase and the humerus starts to torque forward, we get that dynamic valgus as everything up here is still kind of going back. So what the sleeve does is it kind of gives us that external muscle over the medial elbow, like the sartorius in the lower body, but it also gives us a new kind of force angle almost halfway up that lever. So we're able to offload stress 15, 20, sometimes up to 30% consistently, not only at the elbow, but also at the shoulder. So I wish there was some kind of technology we could use to show how that works, how much we're offloading the rotator cuff as well. But we've had great success with it. A lot of physical therapists are using it in clinic and recommending it, getting a lot of doctors recommending it. So they definitely see the medical benefits, not only for rehabilitation, but also recommending it, so athletes don't get injured.
Yeah, definitely, for sure. And if you don't mind, I'd like you to talk about how we quantify stress. We use that Newton meters. So if you can explain really as best you can in baseball terms for the audience, what that means, the load of stress in Newton meters.
So we've got the UCL that attaches these two bones together. So we've got the medial epicondyle, the humerus, and then we've got the ulna. So when it goes back, you have kind of that distraction force. So it's how much that pulls. And that UCL, that's what holds those bones together. So remember, the muscles are always our first line of defense because muscle stabilize joints. And because the elbow is a hinge joint, it just does flexion and extension. It's not really made to support a lot of stress at that angle. Now we have, the adaptation because we've been throwing so we can better handle it. But the problem is the throwing demand is so high and we're putting so much stress on it that's why it breaks down. So as far as the Newton meters, we're seeing a pretty big decrease in the Newton meters of stress because we're preventing what's called the dynamic valgus, or that separation force that we were talking about at the medial elbow.
Yeah, and that's true. And there was a reason why I led you down that path. Where can they actually go to see the proof in the pudding on how that stress gets lowered by using the kinetic arm? Where can they find that? On your website, on your YouTube?
Yeah, we got some videos on the website, but on the Kinetic Arm YouTube channel, we have the individual videos. So there's kind of a summary video on the website where I'll show a long-term before and after, because that was a frequently asked question. People would say, now, is this kind of like a crutch or a cast? When I take it off, I'm going to be weaker. And the answer is no. And I show that in the data because you still have to generate a lot of force to throw that ball. So the sleeve's not going to do it for you. So we're not going to get the atrophy of the muscles or the connective tissue, like if you had a cast on, you take it off and then that muscle's atrophied because you weren't using it. So you're still having to use the same muscles. You're just taking a lot of stress off the connective tissue because we reinforce in the weakest range.
There you go. So yeah, exactly right. You can find that on the YouTube, Kinetic Arm. And as we say, go to the website as well, get as much information. It's all there. Jason's done a fantastic job of it. His team is just, they're constantly there. Again, let's remind them, Jason, how long has this journey been in place for you, man?
Well, the education has been lifelong. I mean, the experiences are invaluable as far as the injuries, the surgeries. I always joke and say I've either had or rehabbed somebody through just about every injury you can think of, because I get a lot of athletes that are injured, and sometimes I'll have doctors or physical therapists send their patients to me when they can't figure out what's wrong with them, because I can address the muscular system and find out. So just developing the sleeve, that was about 5 years. I got an industrial sewing machine. I sat down and made some really ugly contraptions that worked, and you could feel, that they work, but nothing that anybody would buy. So, it took 5 years to, test, retest, constantly refine it, make sure that all the lines of force were accurate, try to make it adjustable to fit, kind of different arm slots and different body types. And now we're about 7 years in.
Yeah. Tremendous journey. And I know, and the dirtbags out there are going to get to know it if they haven't already started to feel it, that it is a passion of yours, and it's not going to be, once to market, it's going to be done. No way, not a chance. This is going to be your life. You're invested in this in every step of the way for sure. So one other real quick but vital question is, and you've already got it probably 100 times down in your area and stuff like that, the how, or how do we know, or when do you recommend somebody getting the Kinetic Arm?
I would recommend it. Well, now we've got kids that are kind of, I don't want to say needing it younger and younger, but we hear about Little League elbow and Little League shoulder. So the big reason this was developed, so everybody kind of goes back and forth on proper throwing form or mechanics. That's great. While everyone's figuring it out, and it depends on the athlete and the body type, there's a lot of variables, but at least put this on so you can minimize stress, while you're figuring out what works best for the athlete. Because with growing pains like Seaver's disease or Osgood-Schlatter's, the kids aren't able to push off from the ground and get that ground reaction force. So the arm ends up taking over, and then we get that breakdown. And then when they get, Little League elbow, if that keeps happening, they can get what's called an avulsion fracture, where the bone will actually kind of crack away. And I've also seen in younger athletes, probably 9 times out of 10, they have a limitation in trunk rotation to their throwing side. So there's a lot of things that instructors and coaches either don't know what to look for or have the time to look for it. So hopefully we'll have the youth model out soon, but I'm a big nerd and a perfectionist, and I need to make sure all the lines of force and the amount of force are perfect. But for the version we have now, it fits down to about, 12 or 13-year-olds. And at that age, that's when I started having bad elbow pain. And I was actually talking to Kyle Farnsworth yesterday about it for quite a while, about, how we constantly had to down Aleve, ibuprofen. In my baseball bag, I had Aleve, ibuprofen, Tiger Balm, Icy Hot, capsaicin HP. That stuff's dangerous. But it's as we were saying, it's tough because we don't want to stop playing, and baseball's a shuffle. So if you get injured, there's a couple others that are ready to take your place, and especially when you get to the high school and college age, players can't say, "Hey, coach, my arm hurts," which is a big problem in baseball, is communication. Sometimes you don't even want to tell your parents because you want to keep playing. So your son or softball, your daughter, they may need it and just not want to tell you. But a really big reason for having it as soon as you can start to use it is because we can prevent that stress before it becomes an issue. So the biggest thing is preventative maintenance. So now you can work on your pitching form, get more throws in, you can get more game speed reps in practice. I always say that, communication is one of the biggest problems in baseball. So, think if you go out the first day of tryouts or a camp, whatever it may be, you can't say, "Coach, do you want me to throw 50%, 60%? You can't ask those questions. So you go out there guns blazing. And that's when I would usually wreck my arm in the first couple of days, because I wanted to really show out. And then we've got these showcases too. So with all the throwing that's done, pregame, bullpen, in between innings, things like that, it almost makes pitch counts irrelevant. I saw a great abstract done that said it was about 90% of throwing is done outside of games. So if we can, even if you just use it in practice and protect your arm for that 90% of the time, you're not going to have that accumulated stress over time, because that repetitive micro trauma, we get some fraying, some more fraying. And a lot of guys, when they have their UCL blowout, they didn't even have any arm pain before that. So it just kind of came from out of nowhere.
Yeah, and Dirtbags, I'm not going to be as humble as Jason was there. And I know as he keeps doing these videos with you, he's going to drop the hammer on you. He's not afraid to drop it, and he's still feeling it out and being a nice guy too. But the bottom line is, get it. Don't fool around with it. The points he was making, I lived it. He lived it. Everybody's lived it and stuff like that. If you've been able to play at the collegiate level, the pro level, whatever it is, if it gets ahead of you in arm soreness, you don't get ahead of it. Yeah. Because like you said, Jason, we don't communicate. A lot of coaches, because of the ego, which is sad but real, it doesn't allow them to have that communication that you said. And that's the bottom line. You and I talked about it off air last week, endless. And it's so true, buddy. It's without that communication, you are in a trap. Yeah. So, watching Dirtbags, being part of the nation, whatever it is, we're going to tell you what you need to hear, not necessarily what you want to hear. Okay. And we're doing it for the exact reason Jason's talking about, to make sure your baseball journey is great. So I'm not as humble as him right now. And I know he won't be. Like I said, you get it and you get moving in the right direction with it, because the other thing, you haven't been able to go down this road, but I know it's on your mindset for sure, Jason. But you have players right now that use it in practice, obviously, but you also have players, not necessarily maybe an official product within a league, but they are using it in games as well.
Yeah, we've got a lot of guys that are using it in games. One particular story, I was messaging with a dad that just bought one, and he's not too pleased with kind of the care he's been getting at the surgeons. And I said to him and another local teenager that came in with his dad, I said, you got to remember, surgeons get paid to do surgery. Yeah. So they know very little. I'll say very little to nothing about prehab and about rehab. And I always say, I firmly believe every surgeon and PT should go through at least one surgery, so they know what it's like, when they have to when they have to go through the rehab. But we had a kid come in. His parents were about to schedule him for Tommy John surgery. And he came in, I optimized his muscular system. He wasn't able to throw off a mound without elbow pain for 10 months. So we get him tuned up, get the sleeve on him. He goes out, wears it in a game. 2 days later, he's pitching off a mound, 70 pitches, 0 pain. Pitches 2 days after that, 90 pitches, 70 strikes, 0 pain. Said he felt like he could throw a whole nother game. So it's just a kind of a big testament to how much we can offload elbow stress. But the healthcare and kind of the baseball industry as a whole has really got to step it up. So if we can help bridge that gap in the process, then let's do it.
No question about it. No question about it. And that is a fantastic segue right there, Jason, on where we're going to go Dirtbags next week when Jason comes back. We started learning about the kinetic arm, the pieces. Keep the research. Send those questions to myself. I'll send them to Jason. Send them directly to Jason. Where can they find you again, Jason? If they want to email you?
I get all the emails through the kineticarm.com or through our social media, which is also the kineticarm.com on Facebook and Instagram.
Beautiful. You don't have to go right to us. Go get right to the man. Get right to the man. We're just we're the guys doing the interviews type of thing and setting the pieces in motion for sure. So, but the segue is now we're going to start going to the other side of what Jason loves to do, and that's the elite edge fitness component part of it and the body and how it works. And next week you got to tune in because we're going to start going down the path of learning the realities and the truths of warm up, stretching, rehab, prehab, as you just said, and let Jason talk about them. And it's going to blow you away with a few of these things. You think he's a neat guy already because of the kinetic arm. You're going to sit back and go, man, I'm all over this guy. I love it. I love it. Just like us too. So Jason, have a great week. I know you got a lot on your plate this week. Thank you for opening up to the dirtbags out there. Thank you for sharing this knowledge with them, your intellectual property, the Kinetic Arm product. And we are looking so forward to this journey, brother.
Awesome. Thanks so much for having me. And let's get going with the questions.
You got it, brother. All right. Just like Jason said, if you got questions, send them in to us. Kirk at dirtbagbaseballnation.com. You know it. Share it. Tell people out there that this is happening right now on Dirtbag Baseball Talk. They got Jason Colleran on talking about the kinetic arm and talking about elite edge fitness and how the body works, functions, what's right, what's wrong to make you have the best baseball journey possible. Because like Jason and I say, it's all about educating and empowering you, whether you're a player, a parent, or a coach. So on that note, Dirtbags, we'll be right back here next week. And until then, everybody get up, get after it, and get dirty.